You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney.
Hey, COIQ listeners. This is Wendy Bacigalupi. I'm the Chief Storyteller for Legacy DNA Marketing Group. So you're used to seeing Dr. Roxie asking the questions, but today we're going to change things up a little bit. On this episode, we're flipping the script. We changed the name of our podcast and video show, and to talk about it, I'm sitting down with Dr. Roxie to give us a bit of the backstory. Welcome, Dr. Roxie. How does it feel to be sitting in the other chair?
It feels great. I'm anxious to, kind of give a little bit more context about why we're changing the show and what to expect coming up.
All right. Well, I've got some questions for you. I'm going to jump right in and feel free to kind of build on them. So originally the show was named COIQ with Dr. Roxie. So I have to ask, what the heck does COIQ mean?
You know, it's funny because a big part of the reason why we're here is because so many people have asked that same question. So the backstory behind this is I was getting my doctorate, and the conceptual framework, I know this is going to sound super nerdy, but the conceptual framework that I was using for my doctoral study was COI, Commercialization of Innovation. And when I first started the show, it was really about 2017 when I had just graduated, and I was really excited about my work and this framework and everything that I'd done. And so it just made sense to incorporate COI into the show name, into the brand of the show, because that's really what I wanted to, focus on is commercialization of innovation in healthcare. And then, we were brainstorming with the team, this idea of IQ. Obviously, everybody knows what IQ is. And so we kind of mashed these two ideas together to come up with COIQ, which was really all about elevating or expanding everyone's skills and knowledge around commercializing innovations in healthcare. So that's really the story behind it. That's the story behind COIQ. COIQ with Dr. Roxie. Obviously at the time, again, I was really excited. I graduated. I'm going to be the next Dr. Phil, Oprah in this world that we live in. And so, just adding my name to the name of the show sounded really important to kind of build trust and credibility with our audience.
Excellent. So kind of going into the doctor title. So put yourself in these shoes, the Dr. Phil of commercialization of innovation. What kind of problems do you solve for your viewers?
So I think, the main point or purpose of the show is to really be able to share all of those strategies and tactics that health innovators need to deploy or to circumvent, and to really give health innovators a platform to be able to share their stories, share their struggles, or share some of the, the winning strategies that they've deployed over time. So that way they can share that with other folks, as well as being able to just inspire and encourage other people, because let's face it, bringing an innovation to market is very difficult, especially in healthcare. And so I really wanted this to be a place where other health innovators felt inspired, felt encouraged, and then also gained a lot of knowledge, wisdom, and skills that they could go back to the office immediately and deploy to be part of that 5% that actually succeeds.
Makes sense. So to me, COIQ makes a lot of sense based on what you've just described, the problems that you're solving. So what is prompting the name change of the show?
Well, it's funny that you say that, because COIQ makes a lot of sense to me, right? That's I came up with it. But the problem is that it doesn't make sense to our target audience. And this is something that we preach all the time, is that we're not the hero of the story, that it's all about the customer. It's not about us. And lo and behold, through working through some conversations with business advisors and mentors over the last couple of months, it's always funny when someone's putting up a mirror and allowing you to see yourself in a way that maybe you hadn't, and kind of removing some of those blind spots. And so I talk and preach a lot about not making it about you, making it about your customers. And it came to my attention that COIQ with Dr. Roxie is in fact all about me, and the show isn't. And so I wanted to remedy that. And then I can't tell you how many times where I'm having conversations with people and no one knows what COIQ means. Although it's very meaningful with me, it doesn't resonate with our viewers and with our listeners. And so I needed to fix that. And they don't even know how to pronounce it, right? It's like it's Coke, it's Quirk, it's COIQ. I mean, it's been called all kinds of different things. And actually, rarely does anyone even call it COIQ, just the letters. And so, that is certainly not a great strategy for a brand name to come up with something that people don't understand and don't know how to say. So we definitely are here to remedy that. We've done some work over the last couple of weeks and last couple of months on really transitioning the show into something where people, health innovators, would know immediately that this is where they belong and how they're going to get value from it.
So in essence, you're kind of drinking your own champagne. And
Finally,
we're kind of getting toward the end of a very challenging year. And so this, I think, would be kind of an interesting thing to discuss too. This has been a tough year for everybody. Healthcare, non-healthcare, first responders, non-essentials, it doesn't matter. Everybody's been struggling. How do you feel that the essence of commercialization of innovation has helped organizations in this particular landscape?
Yeah. I mean, I think the conversations that we have on the show are really more important than they ever have been, because of the things that you're talking about. So science and healthcare is part of our daily conversation across all consumers, across the country, across the world, right? It's not really just us in the industry talking about and being passionate about these ideas. And we've all talked about it. We've seen maybe 10 years of adoption accelerated in the last few months. And so that's kind of a silver lining of what's happening in the industry. And so what you have is more players, more dollars being infused into solving some of these healthcare problems, both the problems that we were facing before the pandemic and some of the new challenges that we're facing. And so because you've got so many people that are starting businesses that are starting getting into the healthcare vertical and billions and billions of dollars being infused here, it's just more important than ever that we're teaching and we're coaching and we're having conversations about how to invest those resources, our time and our money, in the right strategies, in the right tactics. I talk a lot about on the show that the statistic of 95% of innovations that are brought to market, fail to reach any adequate level of customer adoption or financial ROI. And this show is really here to remedy that. And I feel like it's more important than ever because so many innovators are coming up with incredible ideas, incredible solutions for some of the most difficult problems that we're facing. And I want to make sure that we're all coming together to kind of more incubate and support each other in this ecosystem so that those innovations can successfully get into the hands of the people that need them the most.
Got it. Now, with 2020 being such a year of change and COIQ embracing that change, nurturing that change, and even earlier in the pandemic, a primary focus was pivoting that business, pivoting that innovation to not just survive but actually sustain through a pandemic or any business condition. So we're not just stovepiping into a pandemic situation, but really any kind of volatile market conditions. But so based on change, how or is the show changing with the name?
Yeah. So, I mean, I would say that besides the name of the show, everything else will really stay the same. It's still about innovators. It's for innovators, from innovators, about innovators that are in the market. And that is going to stay the purpose of the show going forward. Because I just think that sharing our stories with each other is really building community and really being able to help each other. So that will definitely stay the same. And I think kind of to your point around pivoting. So, like you said, so pivoting has been, a business strategy that we kind of have to look at different times in our business, way before the pandemic. But that is also a big part of the conversation here is being honest about, whether I need to close my business, and then being honest and kind of really intelligently exploring some pivot strategies if our original business model is no longer successful because of everything that's changed since the pandemic. And so being able to explore those different paths to profit that might be better suited for our business going forward, going into 2021.
Excellent. So, what would be the main idea that you would like viewers and listeners to take away today?
I would say, it's a lesson learned that it is so difficult, even when you intellectually know all of these best practices. It's so hard to be able to apply them yourself. Make sure that you have advisors and mentors and consultants that you're surrounding yourself with that are willing to tell you the truth. And just candidly, sometimes we have to admit that we're wrong and that we've been leading our teams down the wrong path, that, and we've got to be honest and have self-awareness about that, and then do the right thing and make the changes. Because like I said, the show was never really intended to be about me. I was always wanting to shine a spotlight on those innovators that are in the trenches, and, like I said, giving them a platform to be able to share their stories. So just the biggest takeaway is, being self-aware, being honest and admitting when we're wrong, and then adapting our strategy. No different than I tell other people, adapting your strategy when you realize that you are going down the wrong path, and write that as quickly as possible. Yeah. So the Health Innovators Show is who we are going forward, and I hope that resonates more, that people feel like they belong here, and tune in and share it.
Excellent. Well, I think those are my questions for today. So again, this is Wendy Bacigalupi with Legacy DNA, and keep on watching the show.
Thank you.
Thank you, Dr. Roxie.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.